Air pollution is a growing concern for many cities around the world, but for the people of Bradford, it is not just a concern, it's a health emergency. A new study from the Born in Bradford project reveals that nearly half of all visits to accident and emergency departments for breathing difficulties are linked to air pollution. In a study analyzing the data of more than 120,000 patients over 4 years, BIB found that air pollution was a factor in 35% of GP patients with breathing problems and 49% of on attendances. We've seen a worrying trend when daily levels of nitrogen dioxide, a pollutant from car exhausts, exceeded recommended levels set by the World Health Organization. Our air quality tracking showed pollution levels exceeded on an average of 157 days per year. Patients are still suffering the impacts of pollutants up to 100 days after their initial exposure. The study used anonymous data from the entire Bradford population and found the impact of pungent gases on healthcare use was far greater than previously reported. Respiratory problems are very common in Bradford, and they make up about 15% of our daily cases, increasing in the winter. Pollution makes respiratory conditions worse, and they present with an exacerbation of their chronic illness. In an effort to curb pollution, a clean air zone was introduced in September 2022, which charges the most polluting commercial vehicles. It generated almost £4.5 million in charges and fines within the first 6 months. We're hopeful that with the changes in traffic flow, we'll see improvements in air quality not only at the most polluted hotspots but across Bradford as well. The BIB research claimed the combined cost of pollution-related healthcare visits to the NHS was an estimated £2 million. During the time of the Bradford study, about 500 people die in Bradford each year from respiratory disease. There are no safe levels of pollution. With the efforts to reduce pollution and improve air quality in Bradford, there's hope for cleaner air and healthier lives.